Hello and welcome to this episode of Cardiotube. It is my great pleasure to introduce Dr. Jaikirshan Khatri from Cornell University. Jay, welcome. I'm Manos Brilakis from Minneapolis Heart Institute, and we'll have a great conversation today about complex PCI and how to learn to do this. So Jay, you've been doing this for a long time and you know it from the beginning, but for someone who is young and eager to get to a higher level of proficiency, do the cases in a better way, what do you think is the pathway in 2026 to get there?
Sure, I think it's the same pathway it always has been. So why did we get into this? We wanted to get better, we want to treat more patients, we want to broaden the spectrum of therapy that we could provide. And what got us into CTO PCI and CHIP PCI was understanding that there are solutions that maybe we didn't get foundationally with our training, with our fellowship, that we can pick up from our colleagues, from our senior colleagues, from going to meetings like this, attending seminars, getting proctorship. So there's always opportunities to incrementally improve what you can do. And some of it is from experience, some of it is from tools, some of it is a combination of all of these things, patient selection. So it's a continuous evolution of our practice. And that's where I think the motivation comes from.
Yeah, and you're right. I mean, we see the patients and everyone has these failed cases and wonders what would you have done different. And it is work sometimes to have these tips and tricks, but it's always better to have some foundation. And I like to always joke that when we're doing the standard training, I was being told, I'm sure same for you, that, hey, you should never do this crazy CTO stuff that people are doing. And sure enough, a few years later, now we're doing all that stuff.
Exactly.
And I think it reflects, as you say, the understanding of what is available and what is not. And you're seeing it, of course, because you get referrals from complex patients failed elsewhere. But I think even the average interventionalist who does fewer cases, still they're seeing more calcium, more tortuosity, they're seeing more anatomic substrates. What is your sense? Is that people living longer or us feeling more comfortable dealing with these complicated subsets?
I would totally agree with you. I think that the level of complexity and associated comorbidities has just accelerated. And whether it's because our population is aging, whether the medication is working, statins, it's debatable what the mechanism is, but clearly the lesion subsets that we're taking care of today are very different than when you and I were training.
The techniques and the skills are important, but also the equipment has evolved over time. And I know now pretty much everyone does radial for the majority of cases. Can you do this complex case with radial?
I think that you can. I think that there are some practical limitations to how this can be implemented, but we have to back up a little bit and just start with where are most people comfortable? Because if you're not comfortable, it's going to be very difficult to progress. So most people, I think, are quite fast on comfortable with transradial access. Most labs are very comfortable with the setup. So I think that that's an important foundation to not abandon. I think it's a foundation to build off of.
Exactly, and many people are worried that now you have to go 8 friends and put 45-centimeter long seats, and people may not feel comfortable with this. Although I think it's probably less frightening than it seems, but for people early on, it might be a little extra intellectual challenge.
Yeah, and again, I would emphasize it's not just the operator, it's also the entire lab and what they're comfortable with. So we don't want to create a situation where the atmosphere isn't conducive to a successful case.
How important is the equipment that exists in the lab? So you have to have some tools, and how important is the tools? And which tools are the ones that you find important for dealing with tortuosity, calcium, complex lesion bifurcations, for example?
I think that that's sort of what makes this incremental improvement in the type of cases that we can take on is the tools and how to implement them in a way that's effective and safe. But again, I'll go back to what we said before. There's some foundational truths to how we're trained, things that we're comfortable with. And what we want to do is be able to increase what we can do with the tools that we already understand. And that's where I think some of the devices that are coming through can help us.
Absolutely. And there are some simple techniques like trapping, which I know for many people sounds very complex and difficult, but it can be done. And it can be done even in 6 French guides and can really help you for many cases where you are using microcatheters and equipment like that. How do you think people can go about this? How can they go about incorporating things like this technique and the associated tools like trapping balloons to moving on their practice?
I would say look up your YouTube channel because it's by far the most expansive array of videos on all of these techniques, and that would be a great place to get some baseline understanding of what's being done. And then once you have some understanding what you really want to focus on, then you can call in a proctor, you can come to these meetings. There's other resources as well, but your YouTube channel is a phenomenal resource along with the books.
Well, appreciate for the plug. But and, I mean, also, been in some of those videos as well, and you provide a very nice overlay. And I think when you talk, always like your systematic stepwise approach. Like CTOs, many people just try to jump straight to this stiff, high tip load guide wires, and you were early on to say, hey, you can get a soft tapered tip wire and be successful in 70% of cases. I mean, it can really make a big difference. You don't have to go crazy, but right. Of course you have the option if you need to.
Right. Well, so that's sort of the difference between an experienced operator and somebody who's less experienced is the options that we have available. So part of this journey is to start to develop these options to solve the problem during the case. And one of the big issues that people run into is they have a workhorse wire, they're radial, the wire is in the corner, but you can't track it because you run out of torque response or you run out of push. And how do you overcome that? And there's multiple ways to overcome that, but not everybody's comfortable with all of these things.
Exactly. There are over-the-wire options, which require trapping, which, as we discussed, maybe initially, but also there are monorail options that can help you on this to track your wire and deliver your equipment there as well. If you were to start, which way do you think is the best way to go? Is it the proctor? Is it studying and looking at the videos and discussing? Or is it making the decision, hey, I'm going to embark on this journey too? Because sometimes, you may get yourself in too deep of waters if you start tackling these lesions and you don't have the background and the equipment and the expertise to make the sense out of it.
I think everybody has their own style, right? So I don't think you have to do this in parallel or series. It sort of depends on what you're most comfortable with in terms of your progression. But everybody has their favorite workhorse wire. Everybody knows how to get it down a coronary artery. Everybody knows how to use a rapid exchange catheter. Sure. And so we use all these tools with various degrees of success in challenging lesions, but that's where you start, and are there tools that can make that better? You can move from there.
Wonderful. Now, when you start doing that, you're going to run into trouble and things may not work immediately the first time. How do you deal with that? Do you call someone at the end? Do you look it up? I mean, what is a good way to overcome the cases where they don't go as smoothly as you would like them to?
It's tough because, I mean, this is patients that we're talking about and having to speak to them and their families about why a case didn't succeed or why there was a complication. Those are things that we unfortunately all have to face. That's the reality of our jobs. But being honest with yourself and with the patients about what you're able to do at a comfortable level without taking it to a point where you potentially could increase the risk of the procedure, I think that's an incremental thing that improves over time, and it requires both being honest with yourself and then stopping, watching videos, reading, coming to conferences, having proctors come out. If you have a senior colleague in your department that can help with these types of cases, that's certainly an invaluable asset as well. So there's lots of ways to overcome this, but ultimately it comes down to being honest.
Yeah, no, absolutely. Completely agree with you. And as you said, you don't have to do this alone. And many labs, I know, encourage this, especially for their junior partners, to scrub in with one of the more senior people, not only for the help, but also to help kind of diffuse the tension if things don't go as well as they could have. So if people can, I agree with this, great way to learn and get the also collaboration going on and feel more comfortable doing that as well. So to summarize, the world is moving and the lesions will not be getting simpler. They're going to be getting more and more complex. We talked a little bit about doing even more complex cases with the things that you have right now and potentially obtaining some of the other tools that you may not have or be familiar how to use them. And we talked about getting help, reading, studying, potentially getting some proctors or working with a senior partner. Any parting thoughts? How can people keep their motivation, keep their spark, and get this moving forward?
I think that the motivation is that we're taking care of patients, and these patients are ever more challenging. And for us to be able to meet that need, we have to keep pushing ourselves to expand what we can treat. And that requires going to these conferences and attending all the sessions and watching your videos and reading and taking advantage of all the technology that's being released and having the local industry reps come, maybe even provide proctorship for you or provide other education material. So without this, you can't progress. And as you said, the world continues to move on, and if you don't progress with it, it just becomes ever more challenging.
Absolutely. So Jay, thank you so much. Again, Jay Khatri, Manos Brilakis, CRT 2026. Super excited to talk to you again, and hopefully we'll see more and more people move on that journey and treat better and more complex patients as time goes by.
Yeah, perfect. Thank you, Manos. Great seeing you.
Thank you.